We have a number of folks that are here from the Creo team. Of course, we've got a lot of the engineering team here to give you an orientation on the products. At the breaks and at the end of the day, please, please, please pick their brain on these products. Touch them, feel them, move them. Not the guys and not the gals, but I mean the products themselves, okay? Take advantage of that as an opportunity.
So as I mentioned before, the doctors are going to be talking about their clinical experience and better clinical outcomes, but we also have to understand the economic outcomes and things like education, and we have to get validated publishing on both. So here's some examples. So Zach Ciamolis's study with 284 patients shows that they can do large polyps much, much faster than monopolar technology. So efficiency is really, really important. Dr. Jawade at Baylor basically showed he can do these procedures with one device, not 3 devices. So it's a lot more cost effective. And lastly, a multi-center study in Asia showed that young doctors could learn these procedures faster with this technology and safer with this technology versus monopolar technology. So from an economic perspective and a value analysis perspective, this is really, really important, and that's why I wanted to share that with everybody.
So here you can see that's normal bowel, and in here you have a very complex, very flat polyp across the bowel. And what I'm doing with the speed the boat device that you can see here at the end of the scope is just demarcating the area where I need to cut. What I have created here is a blister of fluid with a bit of blue dye to help me to highlight what is polyp and what is normal bowel. Now I'm cutting through the other side, and you can see blood vessels in here. I'm using the microwave just to coagulate them. There is no carbonization. They just get blanched very neatly with no bleeding whatsoever. And this is the polyp that I just peeled, that we analyzed, and is a very early cancer, and the patient was able to have a curative treatment without the need of surgery.
I will show you what we are doing right now with the technology. This is Dr. Daniela Tabacella. She's in Romania right now. She was my fellow 2 years ago. And Creo bring me to me these scissors, and I start to use it. I really like it, the concept, and we start to see some new applications. As Dr. Vega showed you, this is a polyp in the duodenal part. So monopolar sometimes is very risky in this area. So Daniela was the first time using this, to be honest. She never used it before, and she did it right away without any training.
Why is the speedboat technology superior for you doing a POEM procedure? So this is a bleb, and that's a tunnel, and that's where you cut the muscle completely. So it's safer and easier to learn, as Rosen has explained to you earlier. It's got a protective stainless steel hull that prevents the deep injury if you need to protect the muscle. That's critical for ESD and even for the POEM. You don't want to cut the muscle wherever by mistake. You want to cut the muscle intentionally. So the stainless steel hull actually protects the underlying muscle. Then the pain, due to the advanced energy and the technique that's used with the microwave, the pain that you get from the procedure from cutting the muscle is very minimal. That's why I'm able to send the patients home the same day. US health system definitely likes to send the patients home the same day. Every extra day in the hospital, you're given say you're given X amount of dollars for a procedure, and every single day you stay in the hospital is going to come out of that X dollars.
And then becomes the navigation bit. So once you've synchronized it, it's a little bit like GPS in our car, and what we do is we follow the blue line. So we now stop using our brain, we just follow the blue line, and makes life so much easier when you're trying to find 300,000 branches. So basically it's cut down the procedure time quite dramatically. So something that would take me 30, 45 minutes, now it takes me a minute and a half to do. So basically it takes me 1.5 minutes to get to the lesion, and like every good video game, you get a nice target showing up when you're in the right spot, and when you've got your target in line, what we tend to do is we can either put ultrasound or various tools in to see if we're in the right spot, or even better, we've got a CT scanner in our bronch suite, and we perform a CT scan, and in 5 seconds I have an image which tells me where I am.
3 years ago, we had one product serving one indication. Today, we have 8 products on the market serving multiple indications. That's all down to our adaptive multimodality energy platform. That gives us the opportunity to target multiple therapeutic areas across the whole spectrum of therapy. Creo is powering the next era of endoscopy, and I'm going to show you how. We're going to be covering 3 verticals of clinical expertise, which includes GI, HPB, and lung. And we're going to do this by outsourcing our product development with partners who have got expertise in manufacturing these products at low cost. That means the speed to market, the cost of a development, and then the price sensitivity of these products in the market can be managed very closely. So, as I say again, in the next 15 to 18 months, we're going to be launching 4 new products, which will massively increase the volume of products coming out of our company.